Hello, good evening once again. Um, so for this part of the lecture, we'll be continuing on with the generalities of infectious pathology. So, as mentioned before, um, defects in specific portions or specific components of the immune system can predispose you to infections with specific microorganisms. Um, Examples would be genetic deficiencies that lead to inability to produce antibodies, the most common of which is X-linked agammaglobulinemia or Bruton's agammaglobulinemia. Um, this is a type of a genetic defect, which is a mutation of the BTK gene. And the end result, as mentioned, is the body cannot produce antibodies. Um, this predisposes you to the infections of certain virus of practically all viruses, because viruses are one of the main defense against viruses is the production of um, neutralizing antibodies. Okay, so if you have Bruton's agammaglobulinemia, will be predisposed to antibody deficiencies. You will also be predisposed to the infections with encapsulated organisms like Streptococcus pneumoniae, which causes pneumonia, Haemophilus influenzae, which causes meningitis, and Neisseria meningitidus, which causes meningitis as well. So these three organisms are encapsulated organisms. They have a mucoid capsule, and you will be predisposed to these infections with deficiencies of the antibody production, because for encapsulated organism, the primary defense is opsonization by IgG molecules. Because you have poor opsonization because of poor antibody production, then of course you will be predisposed to these types of uh, entities. Okay. Deficiencies of complement proteins can also predispose you to encapsulated bacteria. Um, Specific against strep pneumoniae and Neisseria, because complement components can act as opsonins. We know that the B components like C3b, C4b, and C5b can act as opsonins. Okay. Problems with neutrophil function can cause infections from Staph aureus, gram-negative bacteria, and fungi. And problems with T cells can predispose you to the development of intracellular pathogens. Because as we all know, T cells are necessary for the killing of um, intracellular organisms, particularly with the aid of CD8 positive T cells and MHC type 1. Okay. Now, you can also be predisposed to a lot of infections, particularly very rare infections in acquired immunodeficiencies, and the most common of which would be HIV, since HIV is still considered a pandemic. Now, these organisms that infect HIV patients are fairly common, but they usually do not cause disease because the immune system keeps them in check. However, because of the problems with the immune system, these infections will now manifest. Organisms that are associated with secondary HIV infections include viruses, protozoa, bacteria, and fungi. Okay, so examples include Kaposi sarcoma, which causes, or sorry, it's meant to be pronounced as Kaposi sarcoma, which is caused by KSHV or Kaposi sarcoma herpes virus. It causes a um, locally aggressive vascular tumor called Kaposi sarcoma. Okay, fungi called cryptococci can also cause meningitis, and we usually get this from inhalation of pigeon droppings. Okay, and pneumocystis, which is a, a very common AIDS-defining infection. Apart from acquired immune deficiencies, immunosuppression can also cause infections. Okay, so we use immunosuppressive agents in transplant because you are introducing a new tissue or a new organ in the body, and you don't want the immune system recognizing this as a foreign entity and attacking the transplant. So you have to keep these patients in an immunosuppressed state. Okay. You also have hematopoietic stem cell transplants. Okay. And then um, diseases of specific organs other than the immune system also renders the patient susceptible to specific organisms. So, for example, people with sickle cell disease tend to have asplenia. Okay, so what's going to happen is in the spleen kasi, um, there's very low oxygen tension, and in patients with sickle cell anemia, their RBCs change in shape to form sickles if they pass through areas with low oxygen tension, including the spleen. So what happens then is um, there will be sickling of the cells in the spleen, causing ischemia of the spleen. So the spleen is going to die. And because please remember that the spleen is one of the organs that are involved in fighting encapsulated organisms like Streptococcus pneumoniae. Um, Patients with cystic fibrosis also get respiratory infections, particularly Pseudomonas. Normally, Pseudomonas is not a very common infection. You usually get this in patients who are confined for long periods of time in the hospital setting. Usually, they get it in moist areas like ventilators. It is not common to acquire this in the community. Now, if you have cystic fibrosis is a condition, a genetic mutation involving the CFTR gene, which codes for a chloride transport channel. Now, in cystic fibrosis, you will have very viscous secretions because water cannot go out into the secretions. You will have pancreatitis because the enzymes tend to digest. The enzymes supposedly that are secreted by the pancreas get blocked because of the mucoid secretions, and it will digest, the pancreas will digest itself, causing pancreatitis. Another is that you tend to have very viscous mucoid secretions in the respiratory tract. This provides, this facilitates blockage and the growth of Pseudomonas organisms. Infectious disease results from the interaction of microbial virulence characteristic in the host immune response. So once the infectious agent enters the body, it can either cause cell death, release toxins that kill cells, release degrading enzymes, damage blood vessels, and incite an inflammatory response. Now, viruses cause damage in different ways. Okay. Now, you have to remember that viruses do not infect all cells automatically. There is a term that we use called tropism, which is the predisposition of viruses towards particular tissues. And this is because it needs specific receptors in the cells to allow it to enter, specific enzymes which will allow it to be cleaved off, specific gene components and transcription factors. Okay. Now, once inside the cell, viruses cause injury by directly damaging the cell, either through inhibition of mechanisms of DNA and RNA replication or protein synthesis, production of degradative enzymes, initiation of apoptosis, destruction of HIV, disruption of the plasma membranes, and lysis of the cells. It also causes a whole host immune response, particularly by CD8 positive T cells, which can cause damage to the surrounding cells. Okay. Bacteria, on the other hand, um, have virulence factors. Okay, and they are associated with its pathogenicity. Okay. So plasmids and bacteriophages are mobile genetic elements that encode and transfer virulence factors between different bacteria. So you have mechanisms in place for the gene of one bacteria to be transferred to another. Okay, and this imparts special characteristics to the receiving cell, particularly antibiotic resistance. Now, microbial organisms um, tend to form biofilms. Okay, they tend to cluster together. Okay, um, and these biofilms are um, due to the presence of communities of bacteria. Okay, now bacteria adhere to host cells either through adhesins, which are specialized glycoproteins that facilitate attachment to the host cell. Okay, and you also have pili, which are surface structures composed of a protein called pilin that can also mediate adhesion and transfer of genetic material. Intracellular bacteria can kill host cells by either through rapid replication and lysis, and we see this in organisms like Shigella and E. coli. But other organisms um, facilitate continued growth and reproduction within the cell. Like, for example, MTB. TB is not killed off by the intracellular environment. Okay. Another example of is listeria. Now, some organisms will secrete toxins, and toxins come in the form of endotoxins and exotoxins. Endotoxins is Endotoxin is a component of gram-negative bacteria. Okay, and the presence of large small amounts of endotoxins, and the chief component, well, of the chemical component of endotoxin is called LPS or lipopolysaccharide. It stimulates production of massive amounts of cytokines, particularly IL-1 and IL-6, causing fever and septic shock. Okay. Exotoxins, on the other hand, are secretory enzymes. Okay. So exotoxins are secretory toxins. They are protein secreted. They are usually a component of gram-positive bacteria. Okay. Neurotoxins are toxins that block neurotransmitter release, and the most important ones are produced by the Clostridium family. Clostridium tetanus, which causes spastic paralysis, and Clostridium botulinum, which causes botulism, um, and causes flaccid paralysis. Okay, we see usually botulism in canned goods that were not properly sterilized. Super antigens are um, antigens or proteins on the surface of the bacterial cell that stimulate large numbers of T cells. Okay, this causes proliferation of large numbers of T cells and causing cytokine storm. Okay, so as mentioned, endotoxin is a component of the gram-negative cell wall. Okay, now STIs are important because one of the most important pandemics um, in the world today and has been for the past couple of decades is HIV/AIDS. So groups at greater risk include adolescents, homosexuals, and IV drug users. Okay, so whenever you see sexually transmitted infections in children, in the hospital, we usually report it to the child support services because unless it is transmitted from mother to infant, usually you will assume child abuse, okay, or sexual abuse. Most of the organisms that cause sexually transmitted infections are very fastidious. They usually die right away upon exposure to the environment, so they require direct person-to-person contact. Yeah, infection with one STI-associated organism increases the risk for additional STIs. Okay, and this is the reason why if you have gonorrhea or you have syphilis, we usually test for other sexually transmitted infections like hepatitis B and HIV because the risk factor is the same. So these are examples of sexually transmittable infections. Okay, kindly study this table na lang. And as mentioned, this is the spectrum of inflammatory response to infections. So we've talked about this during the inflammatory, the section on inflammation. So as mentioned, suppurative inflammation is caused by pyogenic bacteria, usually gram-positive cocci. So we know the mechanism. So there is increased vascular permeability. Neutrophils are going to get out of the vessels into the tissue. They release their degradative enzymes and lysozymes, producing necrosis and dead material. So that that response produces pus or the yellow fluid or nana. Okay. You also have mononuclear or granulomatous inflammation. We see this in long-standing or chronic inflammation. Okay. In chronic inflammation, Most important cells would be the macrophages, the lymphocytes, the plasma cells. Okay. And one of the effects is the collection of epithelioid um, macrophages due to the classical activation. And the most important cytokine is interferon gamma. Okay. And you have a collection of epithelioid macrophages ridden by fibroblasts and other chronic inflammatory cells is known as a granuloma. Okay. So viruses can also cause damage, causing specific alterations in the appearance of the cell. Okay. And these are known as cytopathic effects or CPEs, cytopathic effects. Examples include inclusion bodies seen in herpes, as seen here, fused cells seen in measles virus, blisters seen in herpes, and warty excrescences seen in papillomaviruses. Of course, as cells die, they're going to be necrotic. And practically all types of infections which cause damage to the cells can cause tissue necrosis. Okay, so chronic inflammation and scarring go together. There is an attempt to heal because these inflammations tend to be slowly progressive. Okay, so as the body, due to the prolonged time course, the body will attempt to heal itself as well. So how do we diagnose these agents? Of course, tissue biopsy using routine hematoxylinaceous sections. Sometimes we may need special stains, for example, gram stain for bacteria, acid fast for microbacteria, silver stains for syphilis and other spirochetes, Giemsa stains for mga bloodworms, like for example, mga leishmania. Okay. We also need cultures of tissue or other body fluids, and serology. You might need to do antibody titers. Okay. So that ends the second part of our discussion. Please submit your notes, and by this afternoon, you'll be having another activity that will lead into the series of lectures that we'll be having for Thursday. All right. Thank you very much for listening. I will see you around. Thank you.